Hey guys, hope you're doing well. Tonight I'm going to be talking about um, I should say test taking strategies or general strategies when you're approaching exams. I have people come to me all the time and say, I'm just so bad at nursing exams. I was so good before this, and I'm just really struggling. What can I do to get better? So hopefully some of the strategies in here will help you. Oh, it's going to do some fancy little thing here. Okay. All right. So, if you're feeling very emotionally drained after studying or preparing for an exam, this is or after, right after the exam, that's a very normal feeling. Just keep in mind, that as long as you define yourself by that score and say that this is how you're going to be, I'm bad at nursing exams. I just can't do them. That's the kind of the general reality or saga you're always going to live out. It's normal to feel emotionally drained. There is a lot of questions and there is just a lot of thinking that goes with these exams. So just keep in mind how you do on these exams is not how smart you are. How you do on these exams is not how successful you will be. And it's not a measure of how you'll be as a nurse. It is how we have to measure your safety and moving forward to get through nursing school. But I'll tell you, there's a lot of students I've had that are incredibly smart that, I wouldn't want me to touch me with a 10-foot pole because you can be very smart, but not very good, necessarily with the bedside manner. And I'm not saying anything against those smart students. You can have both too, but, just don't represent yourself or your future as a nurse based on that score. Because that was me. I mean, I was that student that I literally didn't go to nursing school for a while. Like I got a completely different degree because I was like, I'm not smart enough for this. I can't hack it. And I say, look at me now. Like I'm sitting here and I'm somehow teaching this. And sometimes I think it's a kind of strange, cruel joke that I'm sitting here teaching this, but this is what I'm doing now. And it's not because I'm sitting over here incredibly smart, but one of the best skills that I learned is test taking strategy and how to pass a class, how to understand expectations for these exams. And if I can do it, I always say, if I can do it, anyone can do it. Because everything that I give you, everything on this channel is a result of this is what I needed to get better at this stuff. This is how I learn is through this way. And so I hope that my weird kooky way of approaching this stuff is helpful to you. Something else to keep in mind when it comes to nursing school exams is make sure you're keeping up with your self-care. Are you sleeping? A lot of times you don't realize this. I started this semester really working on my sleeping, and I'm amazed at how much better I feel just with a couple extra hours. And then there's been a few nights where I've like reverted back to old patterns and stayed up late. And man, I was like, how did I live for so many years of not getting sleep? Make sure you're seeing the people that you love and not just watching me all the time. We kind of sometimes I feel like I have relationships with people I don't even realize that, people may spend more time with me than they do their own significant others. So make sure that you're spending time with people other than me or your professors and whoever else you watch, registered nurse RN or whoever else you're into. So make sure that you're spending time because, I mean, at the end of the day, eventually after a few years, I know, believe it or not, you won't be listening to me probably in the future all the time. You may hear that annoying voice of me in your head, but at the end of the day, those are the people are going to, be spending your life with. And so make sure that you're making some time for them to remember about what you get to get back to once you get through these exams. And I always recommend doing at least one non-nursing school related activity a week. Something not hanging out with people that are going to remind you of nursing school. It's kind of like where sometimes us professors will be like, hey, we really need a night out. Let's go out. And all we do is talk about work. So we're like, let's get a night away from work and let's talk about work. So do something with someone that has nothing to do with nursing school to really kind of decompress. So let's talk about some test taking strategies. And I'm going to provide a variety of strategies here. And some of these may seem hard to understand until you start really seeing it in questions, but keep in mind, I'm going to do a few disclosures here is that, every semester is different and every professor is different. So these are general strategies that apply to most questions, but every professor is different. And sometimes for certain subjects, these rules do not always apply. So please do not come back and try to haunt me in the comments and say like, hey, you promised that this was the rule, and stop looking for rules and just start looking for general principles and to start to live by when taking these exams. So just kind of use this as general helpful ways to kind of go about exams, especially if you struggle where you feel like you've got this information, but you're getting questions wrong. Maybe you're looking at them wrong. Maybe you don't understand what they're asking you. So Let's start talking about general test taking strategies. So first things first, the answer you are looking for is probably not going to be there. So, maybe you heard your professor saying an answer over and over and over again. And so you're like, oh my gosh, my professor said this 15 times. This has to be the answer. It probably is not. So, and I shouldn't say it's not, but it may not be. It has, just because like an answer is there and your professor said it a million times does not mean it's the correct answer. Make sure that in order for it to be true, the whole answer is correct. So let me give you a for instance. So maybe, what do you call it? You heard your, professor talking on and on and on about, what do you call it? Like, oh, you have to do cultures first before giving antibiotics. And maybe that's true in most situations, but if in the answer choice it just says, take a culture, don't give antibiotics, but you're like, hey, they said culture first. If you choose that answer, it has to be fully correct. So sometimes like some students get really married to one part of an answer and then the whole answer is not correct, but they're so set that this has to be the right answer because they heard their professor say it. The whole answer, especially if there's two part, if it says do this and this, or there's two, it's like has a comma in the middle, the whole thing has to be correct. And keep in mind too that a lot of times you have to let go of expectations, because I have a lot of students that are like, man, I chose an answer that I knew was the wrong answer, but I just didn't like the way the other answers look. So like, sometimes students will choose an answer because they're like, hey, I just didn't like any of the other choices. You don't have to like the answer choice you choose. You just have to think if it's the best answer for the question being asked. So in other words, like, sometimes you're going to probably have to choose, what do you call them? Some of these, some of your answers that you're going to choose, you're going to be like, no, I want this. So like, for example, I gave a practice quiz for some of my students, and it was like, which of these is a priority treatment for anaphylaxis? And everyone wanted the answer to be epinephrine. But here's the thing, that wasn't one of the answer choices. So, but it was so frustrating to people because they're like, oh, no, the epinephrine needs to be there. Like, that should be an answer choice, but it's not. So if it's not, what is the best answer if epinephrine is not the answer choice there? So don't get married to that, like that really rigid thinking where it's like, this has to be the answer. Because a lot of times that's memorization. You're memorizing, this is what we always do. And in nursing, there's so much gray. So you really have to have more flexible thinking, and that, hey, maybe you're right. Maybe epinephrine is going to always be used for anaphylaxis, but here's the choices you're given. So out of those, can you choose the next best thing? Think about the timeline. So whenever a question's asking you about something that needs to be done right now, you're going to see words like first or priority or immediate. So that should tell you. So in other words, like a question asking, hey, what are the treatments for diabetic ketoacidosis is different than a question that's asking you, what's the first thing you want to do for a client with diabetic ketoacidosis? So always look for those key words in the questions, because if in the question it says first, priority, or immediate, it's saying, okay, you're probably going to do all of these things, but which one is most important? So what needs to be done right now? And so this is the difference between what's appropriate and what's priority. Now, other questions are just going to say, hey, what's appropriate? If it says what's appropriate, there's only one correct answer there. So you need to figure out what's the correct answer. And if you're someone who struggles with prioritization, we're going to talk about it a little bit later in a later slide. Think about what is going to have the most effect right now or the greatest impact. Like which intervention, and like I kind of have here talking about the consequence, which intervention is going to provide the best outcome or like the most help to the patient, or which intervention, if like I do not do it, what's going to be what's going to like be the whatever. Here, let me see if I can say this again. Which one is going to lead to the best possible outcome, or which one is, if I don't do it, there could be a serious consequence. So which of these, like I say here, which of these is going to help to stop the consequences the quickest, the best, the most? And sometimes that can be hard. And sometimes you're like, oh, both of these are really good things, but you have to think about what is the most direct thing that's going to help me right now. So maybe you need to intervene, and which intervention is most important. Like I said here, as previously mentioned, I just was talking about how we want the intervention, what's going to be most effective or most directly helpful. But there's other things we need to consider too. We also usually, for most questions, we want to think least invasive first. So what's the least invasive thing that I could do, in order to that's also going to be effective at the same time. And something else to consider is, because a lot of times, a lot of you guys may have experience working in a hospital or working in healthcare. You always have to remember we're in perfect nursing school world. So we have perfect staff ratios all the time, and money and resources you could ever imagine. So don't ever let that skew your idea, like thinking like, oh, well, realistically, yeah, I probably would do that, but I would never have the time to do that as the nurse. I remember even back when I was in nursing school, there was a question that was like, it was for psych nursing, and it was asking, it was like, hey, this patient, they're really upset. Like, what do you do? And the correct answer was to sit with them and hold their hands and provide therapeutic communication. But I didn't choose that answer. You know why? Because I was like, I don't have time for that. I got meds to give. So I'm thinking like realistically, when in reality, the nursing school is not realistic. It's saying, hey, in a perfect world, what would you do? So we always want what's going to be most effective, most directly helpful, but you may need to take into consideration what's the least invasive thing that we can do if you had all the time, staff, money, and resources. So assessment or action, like when to call the doctor. So if you get a question that's like, hey, which of these do I need to, or like, when do I need to call the doctor, or which of these, findings needs to be reported to the doctor, keep in mind as a, or like, does anything need to be done before calling the doctor? So maybe you'll get a question that has like, 3 options of assessments or action to take, and then one choice is call the physician. That's kind of telling you, hey, it's actually testing your knowledge, testing your critical thinking to see, do you assess first or do you take action first? So it's sometimes students really struggle with these questions, because they're like, I don't know, it seems kind of serious. Do I just go ahead and call the doctor? And the general rule of thumb is that we assess first, unless it would delay life-saving treatment. And I'll talk about that in a second. And so these are the questions you want to ask yourself. Is there anything I must do before I can assess the client? Like, do I need to check a pulse? Like if we're talking in cardiac, my favorite, do we need to check for a pulse first? And then we want to see, is the client stable or not? Like, if they're stable, I can assess first. If they're unstable, I need to treat them first. And is there any assessments the doctor will ask about when I call? So for example, if I'm having, like in real life as a nurse, if I'm having problems, I don't just call a doctor and say, hey, I have a problem. They're going to be like, okay, well, what's the problem? Like, I have to know what's going on. So let's say that, a patient is, with pneumonia or something's getting worse. They have, they're saying that they're more short of breath. I could call the doctor and say, hey, this patient with pneumonia is saying they're short of breath. He's going to say, hey, what do their lungs sound like? What's their oxygen saturation? What's their white blood cell count? I don't know. There's a lot of stuff, they could ask. So, that kind of stuff. But obviously there's some assessments I need to do first. So in other words, if a patient's stable, where they're not like immediately dying, or they have time where I can do an assessment, then, me as the nurse, I need to do any assessments that I can before calling that doctor, because that doctor is going to just be asking me to, hey, go in and do that assessment. And so we usually assess first, before starting any treatment. When I'm talking about life-saving treatment here, like an example would be, like if I went in and a patient had no pulse, I'm not going to call the doctor first. I'm going to treat the patient first. Or, we talk about with hypoglycemia. If I go in and a diabetic patient's unconscious, I'm going to assume hypoglycemia and treat them first. I'm not going to sit there and be like, hey, go get me a glucometer. I think this patient may have low blood sugar. Like the time that it's going to take to do that blood sugar is delaying life-saving treatment, where they could go into a coma, or they could their heart could stop from it. So you always want to think about that. So kind of the overall rule here is, if you have a question that says, hey, Do you assess or treat first? We always usually we're going to assess first, unless there's like a critical situation. And then you have to keep in mind that if you have an option where there's some stuff, hey, do some assessments or call the doctor, usually we're going to do the assessments first. So that way I have all the information I need before I call that doctor. So these are some things you can kind of ask yourself about their stability or not. And if you're asking yourself, well, how do I know if a patient is stable or not? That's something definitely to do in your studying, especially if you're getting into the complex class, knowing which conditions are stable, like which ones, hey, this is what I need to call the doctor. But this is why it's so key in your studying when you're looking through things, which situations warrant that I can do something. Because there's some stuff, there's some, conditions and stuff that people have or situations that patients get in that I, as the nurse, can go in and start intervening and help. But there's some stuff I need to call the doctor. There's nothing I can do. Like, for example, let's say like later in this, later in the adult semester, we talk about compartment syndrome. So if a patient is showing all the signs of compartment syndrome, I've done an assessment, they're doing all the signs of compartment syndrome, all I have left is to call the doctor. There's nothing I can do for compartment syndrome because I cannot do a fasciotomy. The only treatment for that is a fasciotomy. So I need to call the physician. Whereas, like, again, if it was like, if the question was just like, hey, a patient that's in a cast is experiencing some pressure, I need to assess a little bit more first and see what's going on before I call that physician. Make sure you're reading the question correctly. I wish I could put like bright lights off of this slide, because this is like 9 times out of 10 where students go wrong with test taking strategies is, do you know what the question's really asking you? Is it asking you what's right or what's wrong? And sometimes this is a simple error, like literally you read the inflection of the question wrong. So like the teaching one gets people most of the time because it will either say, hey, how do you know the teaching was effective? Or how do you know that that more teaching may be required, etc. And so when you're looking at this, sometimes it can be really confusing and overwhelming because, you're reading the question so quick, you're really anxious and you really think you know what it means. But go back, especially if it's a teaching question, and make sure that you're saying, okay, am I looking for what's wrong or what's right? And then the other, that's a common error, especially because of the nerves and everything of taking exams. But another thing that I see is that people, they read the question and they understand what it's asking for, but they're thinking more in general versus for that specific disease process, priority, or intervention. So for example, like under the respiratory section for adult, there is, some questions that might be asking about airway clearance, oxygenation, breathing pattern, like these are all different priorities. And sometimes students choose good interventions and they're good interventions for a respiratory patient, but they don't match that priority. So maybe they say like, what do you call it, for airway clearance to increase oxygenation. Increased oxygenation may help, but it's not going to help with airway clearance. Like it's not going to help me to get stuff up. So it's really making sure that you understand what the question's asking you. Anytime you're kind of like really caught and you're like, oh, I don't know this one, make sure you really know what the question's asking you. Is it asking you, like what's going to help with decreasing bleeding? Is it asking you what's going to help to prevent complication? Is it asking you what's going to help to advance a particular goal? Make sure that you know specifically what it's looking for, because maybe some of the other answers are correct and it's going to help with that disease process, but is it going to help with that specific priority or intervention it's asking for? And read the question carefully, but do not create a story and do not make your own assumptions. If you find yourself just sitting there and saying like, hey, yeah, well, obviously I would have already done this. Well, obviously this patient has this. Obviously that there's no obviously in these questions. So to go further with that, read just what is in the question, no more, no less. Do not read more into the question than is already there. Do not add any more stories, information, or make any assumptions about these patients. Do not respond to this question or choose answers based on your past client experiences. This was my biggest downfall. I had like 10 years of working as a tech in a hospital when I was in nursing school. And man, I really thought, I was like, oh yeah, been in this situation, I know what I'm going to do. And I always got it wrong. So it could also be a familiar phrase or term that you see that you're like, oh yeah, I know what this is, like, and you're making you just say, hey, my professor said this a million times, I know this has to be the right one. Anytime you're saying, oh, of course I would have already X, Y, and Z, what you think is realistic, because remember, we're not in reality, we're in nursing school reality. Your children, pregnancy, parents, elders, maybe your own personal response to a drug. We had some fun studying the other day, and one of the students is like, here, let me check this box for this one of the medications we were learning. And this is what the box said to take it this many days, but the textbook says something different. So, you always want to look at what the textbook says versus what, even if it seems like, well, that's not even correct. Remember, medicine is always behind so many years, about 10 to 15 years. And if you find yourself saying, oh, well, what if, then you are going down a rabbit hole, and that is not the place you need to be. So let's talk about medications. These tend to really throw people off. And I'm going to break down, I have a slide for each of these. You want to think about what kind of medication question is it? Is it asking you about the medication itself? Like what, something like maybe just knowledge about a medication? Is it asking you about a nursing assessment that needs to be done before, during, or after administration of that medicine? And is it asking you to evaluate effectiveness of medication? Like how will you know it worked? Or is it asking you to do teaching for a client with this medication? And so pretty much like our goal when we give you med questions is not to have you memorize all the meds. It's to see if you were put in a situation with these medications, could you be safe? So you do need to know some basics about the patho, but usually it's more about understanding what are the interactions, what are the problems, what are the adverse effects that a client could have with these medications while you are giving them as the nurse. What do you call it? Try to think as you're studying, what would happen if the patient had too much of this medicine or not enough of this medicine? So if the question is asking you about the medication itself, usually this is the questions that are going to be kind of, do you understand what it is, or how it's going to help? And so if you know the medication, try to do your best to figure out which best describes the medication, how it works in the body, and what its role in the specific disease process, what is expected or hopeful. So in other words, like for example, if I was giving a diuretic, and for heart failure, my hope is that it's going to take fluid off of them, and that they're going to be able to breathe easier, to walk around easier, and get rid of that fluid load. But if the question says, hey, how's heart failure going to help with a patient with how are diuretics going to help a patient with hypertension? I'm hoping it's going to lower their blood pressure. It's very different. So I want to make sure that when I'm reading that I'm actually seeing which medication for which disease process, because some medications can be used for, for many different things. So there was one time I had a clinical student that, put down, hey, there's this medication, and that the patient was getting it for Guillain-Barré syndrome. And I asked, hey, well, do they have that in their history? And they said no. So you always have to think about, okay, well, this patient's getting this medicine. Usually it's to treat this other disorder, but the patient doesn't have that. So why could this patient be getting it? And that's what we want you to be able to do as a nurse, is to be able to go in, generally how medication works, but you can then apply it to how it's going to help this patient, because you as the nurse, you're responsible to figure out, you don't have to know every med, but you have to know, okay, I'm giving this med. How am I going to know it worked? If the doctor comes by and says, hey, how's their blah, blah, blah going? Am I going to be able to say, hey, yeah, I gave this med and this is how they reacted? And so that's something we need to know, kind of what we're expecting in the patient, if there's going to be something hopefully good. And then if there's something bad that comes around, that we recognize, hey, that might've been a result of that med. Well, let's say that if you don't know the medication, some strategies that you can use is you can look for clues in the name of the medication as to what it is or how it can be helpful. Sometimes in the medication itself, it kind of tells you a little bit about it. Try to focus on mnemonics when studying, because sometimes the names can be a little bit tricky. And if you do not know the medication, then look for cues in the question. So, sometimes I've had students freak out because they're like, oh, wait, we didn't cover this disease process, like this med, it's like, well, wait, look at the disease process and think about what the disease is. So let's say, for example, you get a respiratory med, something for asthma or something, and you're like, I have no clue what this is, but what are my overall goals for asthma? What's the problem in asthma? So maybe you don't know the meds, but you know the disease process. How could that, what would be most likely for the way that this medication could help? What am I trying to achieve for this patient as a whole? What if it's about a nursing assessment related to the medication? So maybe it's going to say, what do you need to do? What lab or diagnostic do you need to check before? Or what are some considerations? What are you going to be most concerned about? Or what do you need to monitor? Something like that. Consider, what assessments or labs and diagnostics need to be done. Think which ones will give the most key or life and death information to safely give that medication. So, you know, for for example, you know, there's a variety of labs that might be checked for a diuretic, but you know, checking a potassium can be life threatening, because if the potassium is too high or too low, then it can cause fatal dysrhythmias. Think, you know, what assessment or lab or diagnostic, if you don't do it, could lead to a problem or complication. So as a whole, you're trying to think about, okay, which one of these out of, like, you know, if there's a couple that are standing out to you, which one of these is going to have the biggest effect on the patient, or that's going to affect my ability to give the medication or not. What if you're evaluating effectiveness relating to the medication? Effectiveness is, how do I know it worked? It doesn't mean that the client is fixed. So for example, you know, if I'm evaluating effectiveness on insulin, it doesn't mean that their blood sugar is perfect, but how do I know that they're getting better? So, I mean, for like insulin, even though of course I would love for their blood sugar to be, you know, a good old 70 to 90, you know, as long as it's less than what it was before, I know that it worked. Of course, like a lot of times, sometimes the question might ask you, what's the best measure? What's the, like the thing that's going to help the most with this? But always make sure again that you're reading that question carefully. And I mean, if it's just asking, how are you going to know this medication was effective? You're just looking for how, which direction is it going in? How is it going to, like, what am I hoping is going to happen with this medication? And so when you're looking at this, you know, like I said, some of them, that all the answer choices may be correct. What's the most direct or best measure that this medication is doing its job? And I usually recommend that students focus on the patient assessments over laboratory results. Now, there are some medications that are used to fix certain labs, like, you know, like we give certain things, but keep in mind, you know, we're not just trying to fix the lab. The lab is then going to affect the patient. So, for example, let's say like with anemia. So, you know, what do you call it? Which is the best, you know, sign that, you know, their anemia has improved after blood administration? It's great if their hemoglobin goes up, but how's their breathing? Are they breathing okay? Are they oxygenating better? So you always want to look at that end organ or what's going to help. So, you know, like I say here, labs can be improved, but how is the patient feeling? So for example, diuretics, like a patient could be peeing a whole lot. Like, so let's say I was saying, like, how do I know a diuretic was effective? You know, I'm looking at the symptoms in the patient. So the patient tells me, hey, I'm breathing better. Hey, I can get up and walk around now. Hey, I have less edema in my legs. Those are all great things. My patient can say that. But you know, the big thing here is that if I'm just looking at, hey, oh, the patient had 2 liters out. You know, I've had patients that have peed liters out of fluid and they were still incredibly overloaded. So to really see that the medication is effective, I'm looking in their organs, their symptoms, or a change in their actual like physical status, like something that I can see or measure through an assessment, you know, of that patient to see that they're better. So I'm looking at the patient themselves instead of a lab or diagnostic usually. So to see that, hey, there's something better here. And so what do you call it? For example, like, you know, I mean, it's great. Like, you know, I mean, my goal to give insulin is that, you know, of course, you know, that their blood sugar is going to go down, and I'll know it's effective if their blood sugar went down. But, you know, also I'm hoping for other things. I'm hoping that they're going to have less complications and other things as well. So yeah. So what if it's a medication question that's related to teaching about the medication? So teaching questions will either ask, hey, what's most important, or what's the priority? Like, you know, priority teaching, what's going to demonstrate effective teaching, which means, hey, the teaching went well. I'm looking for what is correct, and all the other answers are correct or incorrect, excuse me. And then, or it could be asking what's going to demonstrate ineffective teaching. So which of one of these is wrong? So you need to know what is wrong and what is right when it comes to teaching. So it's a great thing to tell you when you're studying, hey, when I'm studying, I need to learn, hey, what I need to teach, and also what would be wrong with teaching. Make sure to read the question carefully. Again, like I brought up, that ineffective versus effective teaching, because a lot of times students, because you actually, like when you're reading, you don't actually read the whole thing. Your brain like fills in the blanks. And so sometimes you really think it said effective teaching, but it said ineffective. So after you read the question carefully, then think what teaching is most appropriate. So stay away from extremes that are something that says, like, you know, there's really not a whole, like the only thing that we ever say like never is like stop smoking, you know, so that's the only thing that we usually tell you to stop. But most of the other stuff we say is like moderation, like limit your drinking, stuff like that. And usually when teaching, there's never a time that I'm like, hey, by the way, if you're getting side effects, stop taking your medication. Like there's never any time that I'm usually like, tell them, hey, don't take your medication, because that's not safe. And that's also me practicing medicine. There may be times that I say, hey, don't take your medicine, but come on in and see us because something's not right. Like, like, hey, just hold out, come on in and see us. Because I shouldn't say, I never really tell them don't take your medicine, but I tell them more like, hey, like you probably need to come and be seen. Like there's something that's not working here. So yeah, so it can definitely come up. Because again, we just don't, we're like, when we're teaching as a nurse, we don't want to do anything that could cause like really negative effects. And if for some reason a patient can't take their medicine, they probably need to come in and be seen by the doctor. So many students don't focus on teaching when they're reading. So this does make up a lot of your exams. And so you want to make sure that when you're reading that you're focusing on this. So when you're doing your reading and skimming through, really take time to look at that teaching. I've had a lot of students come back and say, man, I did not focus on the teaching enough. And teaching is a big role of the nursing, of the nurse when as you're nursing. And so when you're reading, focus on teaching the client what they need to know to expect with their medication and what to know when there's a problem. So they should always know, hey, when do I need to call you? When do I need to get back in touch with you? What are going to be signs that I'm going to be like, I think I need to call my doctor about this. Let's talk about the dreaded prioritization. So a couple key tips here, and I could probably do a whole PowerPoint over prioritization. It's hard. It's definitely a skill. A lot of the principles behind prioritization are going to be going with your, as you've heard many, many times, ABCs, your airway, breathing, circulation. And your airway is going to be, anything involving your ability to not choke or cough stuff up. So think like when you're thinking about it, is there an issue with keeping their airway open? Is something obstructing their airway? Is there something closing off their airway? That's always going to come first. Something that's going to cause a problem with that or something that's going to help with that is going to be usually first priority. Other times it may be a breathing issue, like something that's affecting their ability to oxygenate, something that's affecting their ability to have a good breathing pattern. And then other times it's circulation, which is like, blood pressure, how well am I getting enough fluid in, or do I have too much fluid, etc. So sometimes when you're looking at it, when I say all these things, I'm telling you because I want you to think about that you may have a question that's going to require you to kind of look at this and say, hey, what do you call it? Which of these would come first? And so if there's a problem with my airway, it's going to become before what I need to fix for a problem with my breathing, and vice versa. Or as I go down the line, if there's a problem with my breathing, I need to fix that first before circulation. So this isn't to say that I always have to use my ABCs, but if you're down to a question, you're really not sure, and you're like, what should I do first? Usually we're going to do the stuff, we always have to think about what's going to kill the patient first. Like, what do you call it? I've heard a professor call in the past the kill factor. What's the thing that is going to put the patient most at risk for like a life-threatening problem? And so we usually start with our breathing issues and our airway stuff first, and then circulation. And then if I have other issues, nutrition, elimination, being able to pee or poop, mobility, like those are priorities, but they're not going to come before these ABCs. You can also think about your Maslow's priorities. So physical needs always come first. So if there's a psychosocial need as an answer choice, and it's really kind of pulling at your heartstrings because, hey, maybe you're an emotional person like me, I get it, but really start thinking about, okay, so maybe there is a physical, maybe there is an emotional need here, but, Maslow's, his priorities or his hierarchy of needs, always said that we have to start with the physical needs first, like physical needs first, like my basic needs have to be met before, those psychosocial needs can be met. You can also use the nursing process. So like we talked about before, we assess first, unless it would delay life-saving treatment. We want to gather data, and then we diagnose the problem. We plan the best course of action based on that specific situation and patient priorities. Then we take action and evaluate. So, a lot of times that nursing process is going to come in with, hey, I need to assess first. Hey, there's a situation going on. What do I do first? But these are just a few things that you can kind of use as you're going in. And when you're, and again, again, really using some of that other stuff that I talked about, and really thinking what's going to have the biggest or most direct effect. So, there's a lot of interventions that may help a patient, and maybe all of the answers are correct, but which of them is going to have the biggest effect right now? Or again, go back and look at that question. What is it really asking for? What specifically are you trying to accomplish for this patient? So always just try to think about what's going to have most effect, the most direct effect, the biggest effect on this patient, or which intervention, if you don't do it, could lead to very serious consequences. Oh, everyone's favorite, therapeutic communication. Keep in mind the answer will never be, I believe, or saying, what you think as the nurse. Like, so if a patient, is sitting there and saying, like, expressing themselves, and you're like, I don't believe that's true, or, in my experience, blah, 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 it's all about the patient. There's no I in therapeutic communication. And when I say that, I know that there's actually I's in the word therapeutic communication. What I mean is that in answers and answer choices, there's not usually going to be an I, like I think this. It's always going to be about the patient. So focus on the patient's feelings, thoughts, and behaviors. And usually a lot of times the right answer will be those open-ended questions, because they really allow the patient to express themselves. So what are some key words to look for in questions? You want to look for words that tell you timing. All right, is this an early sign or a late sign? Usually early signs are going to be less serious than late signs. Like the early signs, it's kind of like maybe some general like GI distress or something minor, whereas the late signs are going to be like, hey, yeah, their heart's about to stop. So you always want to look for it. So for example, for like tuberculosis, the early signs, maybe they're losing weight, they have the prolonged cough, they're having some night sweats, where the late signs is, hey, they're coughing up blood, and they can't breathe. So those are very different in symptoms. And so that's also helpful as you're studying to kind of write down and say, like, okay, what are the early signs versus the late signs? Not every disease has them, but if they do, you should take note. If the word says initial, like what's my initial action, that's telling you first, priority, what's most important. Maybe it says after several days. So you always want to think about what's the timeline here, what's expected like early on, like in recovery versus later on. So let's say we're talking about like a post-operative patient. Sometimes some disease processes there only occur like days or times later. Sorry, my cat's trying to eat me. You also want to look for words that tell you if there's a priority, or if it's just a maintenance. So if it says immediately, first, best, or priority, like that's talking about what you need to do right now, versus like, hey, this is as a whole, I just want you to know what's appropriate. So is it just, hey, you need to do this first immediately, or something bad's going to happen? Or is this just, hey, this could help the patient? Look for words that are going to tell you that you're looking for like what's most common. So if you see the word common, you're thinking about like what's most likely versus least likely. And usually if you're thinking about something that's very common, like for example, it said, hey, what's a common side effect of a medication? Keep in mind, like something common is probably not going to be something very deadly. If it's something common, there's not many meds that we give that's like, hey, a common symptom of this is death. I know you guys see all those commercials and that's how they phrase them, but generally most of the time, the common symptoms are going to be stuff like GI symptoms, or like minor aches and pains or something like that. It's not going to be something like life or death. So what if you honestly do not know? So if you honestly do not know the answer to a question, look for cues in the question, look for something else that can help maybe lead you to an answer, and try to narrow down the choices. So some ways to narrow down choices. If two answers are saying the same thing, they cannot both be correct. Because if they're the same answer and there's only one answer choice, they obviously cannot be the right one. If two or more answers are similar, but just a little different, then a lot of times one of them is correct. So let's say, for instance, that, like it was asking a question about like the Samoji versus Dawn, effect and phenomenon in diabetes. If one of the answer choices is give them a snack and the other ones don't give them a snack, a lot of times one of those is going to be correct for that question. Look for keywords and think about the question. Is it asking for something common, and which answer choice is most common? Like we were just talking about, which one is actually a common effect, and things like sudden death or, crazy intense complications and stuff like that are not usually common. If it's asking about something that is a problem or dangerous or needs to be reported, think, what is the worst of those choices? Like, what's the worst that could happen? So maybe you don't know, and it's not always the right answer, but sometimes if you really have no choice and it's a Hail Mary and you're just like, look at the choices, which one sounds like it would be the worst thing that could happen to that patient? Remember that physical needs always come above psychosocial or other needs, so you can narrow down, cross out some of those psychosocial needs if necessary. Even though pain seems like it's more important, other priorities come first usually. So, excuse me, when we're talking about psychosocial needs, pain is considered a psychosocial need, even though seems like a physical need. There are some medical conditions where pain is priority, and your nursing instructor will tell you about that, or your theory instructor. But keep in mind, most of the time, pain is not usually like top of the totem pole. Usually we're talking about those ABCs, and those are going to come first, definitely above pain. So what happens if you're one of those people that gets down to 2? First, you need to figure out, what is the question asking you? So is it an emergency? So if it's an emergency, what intervention is going to be the quickest or the priority? And think your ABCs and your Maslow's. So if you're down to 2, which of them is going to be the quickest or is going to help you to meet that goal the fastest, especially if you're talking about your airway, breathing, or circulation? If the question is just asking you what's best or what's priority, what is going to have the most direct effect? Or go back to the question. I always tell people, you're down to 2. Now go back to the question. Did you actually read it right? Now read it again. Read it a third time if you need to. Make sure you know specifically what disease process and what priority or intervention it's specifically talking about. And then sometimes that can help break it down. If you're really not sure after doing that, then go with your gut and do not change your answer. So how about those, the favorite among nursing school students, select all that apply. Do not think about or overanalyze how many you're choosing. That's the best advice I can give you. If you're sitting there and saying, well, I did 2 for the last one, I can't have 2 that are only 2. Please stop overanalyzing it. We don't think that much about it, so you shouldn't either. Keep in mind, it should be at least 2, and it could be all. So I have some students that, choose 1. They're like, well, I didn't think any of the other answers are right, but I'm like, it's a select all that apply. At least 2 have to be right. Usually most of the time we don't do all of them being correct, but it's always going to be at least 2. And then it's possible that it could be all of them. Do not compare answer choices. Just go one by one, start at the top and answer each as if it was a true false question. Okay, so you're going through. So maybe it's saying, what are the symptoms of hypoglycemia? So you get to the first one. It says dry mouth. And you're like, true or false? And you think, okay, I think that's false. You go to the next one, true or false. So then don't compare. Don't go and look, well, if that one wasn't correct, this one has to be correct. Like, no, don't start playing that game. So the stakes seem higher in this question, but treat this question just like any others. Like, the anxiety is real. Sometimes these questions come up and you're like, oh, I'm horrible at select all that apply. I'm going to get it wrong. But the fear of the SATA is sometimes half of the battle. Grow towards a new approach. And the less that you fear the SATA, the more the SATA will be good to you. There's no, unless it's in the question, and occasionally there is, SATAs that will have, hey, what's the best thing to do? But usually SATAs are just knowledge. So these are usually simple yes or no. And so break it up into smaller questions and really start asking yourself, hey, is this true or false? Is this going to work for this? Yes or no? Is this going to be a treatment? Because most of the time it's going to be a question like, hey, which of these treatments are appropriate? So you really just have to say yes or no. Is it? Yes or no? Is it? And once you've selected your answers, don't go back and say, you do need to look that you have at least 2. And what do you call it? As long as you have at least 2, that's all you need. Move forward. Don't go back and compare and say, oh, that's a lot of choices. So other general test taking strategies, think if you're in a question, you're just like, I just don't know. Think, what's the worst that could happen if I do or do not take that action? So let's say you have no clue and you're going through and you're like, think about each action. If I do this or if I don't do this, what's the worst thing that could happen? Really got to make sure you don't change your answer, because that's sometimes the worst thing. Is sometimes I talk to students, I'll even study with them, and it seems like they have the right thought process, but then they're like, wait, nope, I'm wrong. I'm going to go back and change my mind. Don't do that. Really trust your gut. For my students, I have them think about me on Carol Baskin's Body, the crazy person. So whatever helps you to stop, getting back into that same pattern where you're changing your answer, do something. If there's some sort of mantra in your head, if you want to imagine me smacking your hand, I promise I'm not abusive, but just whatever it takes, whatever it's going to take, or something that really scares someone or something that really scares you, imagine them saying, don't change your answer, and then, stick with that. And don't tend to spend too much time on one question. If you're truly unsure, go with your gut after, if you're truly unsure after using the strategies, go with your gut and move forward. Because there's going to be some questions that there's just no strategy. Hey, it's a straight up knowledge. I don't have the knowledge. Let me make my best guess and move forward. And know that you're growing and learning with each of these exams. So I know this was a lot, and I know that sometimes like PowerPoints like these can sometimes get more confusing, and you're just like, but hopefully some of this sticks with you. And again, just start taking some of these strategies and using them to start thinking about how you can approach tests differently, because half of it is just the mind game. I hope that this PowerPoint was helpful for you, and I can't wait to see your great successes on that next exam. See you next time.